BSN 315 Pharmacology Hesi V21. Question 1. Fentanyl patch teaching? Non-hairy area. Change 72 hours. Avoid heat. Do not cut. Heat increases absorption risk. Question 2. Propranolol contraindication? Thromboembolism. Antacids. Asthma. Weight gain. Non-selective beta blockers worsen asthma. Question 3. Prednisone long-term effect? Weight gain. Nervousness. Bradycardia. Constipation. Steroids cause fluid retention and weight gain. Question 4. Which stroke should not receive thrombolytics? Hemorrhagic. Thrombotic. Both. Neither. Thrombolytics worsen bleeding in hemorrhagic stroke. Question 5. Bevacizumab adverse effect? Hypertension. Hypokalemia. Hyperglycemia. Hypocalcemia. DAGF inhibition increases BP. Question 6. Which medication is used for refractory angina? Atenolol. Nitroglycerin. Sildenafil. Ranolazine. Ranolazine is used when standard therapy fails. Question 7. Dabigatran adverse effect treatment? Vitamin K protamine. Omeprazole. Probenecid. Omeprazole reduces GI irritation from dabigatran. Question 8. Propranolol contraindication? MI history. Warfarin use. SSRI. Heart block. Blocks conduction further. Question 9. Dexamethasone use in brain cancer? Reduce swelling. Improve focus. Sedation. Depression. Decreases cerebral edema. Question 10. Albuterol plus beclomethasone, order? Same time. Albuterol first. Steroid first. No shaking. Bronchodilator first improves steroid delivery. Question 11. Atenolol should be held for which vital sign? RR12. Pulse 52. BP 134/72. O2 95%. Beta blockers lower HR, bradycardia is a contraindication. Question 12. Beclomethasone teaching? Rinse mouth. Limit fluids. Increase B12. PRN use. Prevents oral thrush from steroid inhalers. Question 13. Which of the following is the primary site of activity for warfarin? Kidney. Liver. Blood. Heart. Warfarin acts in the liver by inhibiting clotting factor synthesis. Question 14. Nitroprusside adverse effect? Ileus. Neutropenia. Delirium. Hyperthermia. Cyanide toxicity may cause neurologic changes. Question 15. A patient on 4-heparin begins vomiting blood. What medication should be given? Vitamin K, atropine. Protamine. Calcium gluconate. Protamine reverses heparin and stops bleeding. Question 16. Insulin peak 1A Euro 5 HRS? Glargine. NPH. Regular. Lispro. Regular insulin peaks midrange. Question 17. Nitrofurantoin teaching? With food. Avoid dairy. Bedtime. Increase vitamin C. Reduces GI irritation. Question 18. Mannitol adverse effect? High glucose. Low urine. Dyspnea. Normal pupils. Fluid overload may cause heart failure and dyspnea. Question 19. Ceftriaxone teaching? Cough. Stop rash. Oral form. Yellow urine. Rash may indicate severe allergy. Question 20. Which is not a side effect of nifedipine? Nausea. Flushing. Vertigo. Sexual dysfunction. Sexual dysfunction is not typical of calcium channel blockers. Question 21. Why prescribe ACE inhibitors after MI? Lower potassium. Reduce mortality. Always combined. Treat hypotension. ACE inhibitors improve survival and reduce cardiac remodeling. Question 22. Which drug causes photosensitivity? Digitalis. Niacin. Tetracycline. Fluoroquinolones. Tetracycline increases sensitivity to sunlight. Question 23. A client with angle closure glaucoma. What finding is expected? Painless vision loss. Peripheral loss. Severe eye pain. Normal pressure. Acute glaucoma presents with severe eye pain and increased pressure. Question 24. Kava adverse effect? Glucosamine safe. Saw palmetto. Kava toxicity. St. Jonah Euro S. Kava causes hepatotoxicity. Question 25. Which drug is associated with synchronism? Valproic acid. Quinidine. Isoniazid. Ethosuximide. Quinidine can cause tinnitus, headache, and visual disturbances.